Yes, welcome back po. No? Para sa ating kalusugan tip of the week, health benefits ng coconut. No? Ang coconut, it improves heart health by providing healthy medium-chain fatty acids o yun yung mga good fats no? That is essential. Unlike yung mga ibang fats katulad ng mga nasa karne, itong sa coconut, unique siya dahil it contains large medium chain fatty acids na katulad ng lauric acid, no? Katulad ito rin yung mga nasa healthy fats na nasa breast milk, no, na very healthy para sa baby. Now, it also is very high in dietary fiber, no? Katulad ng psyllium, oat bran, or ng sa oatmeal, no? And it supplies about 61% of insoluble fiber. Ibig sabihin, ito yung fiber na pagdating sa colon natin, parang walis yan, no, na iniis-is yung colon natin. It adds no calories, so very low calorie siya para sa mga nagda-diet and also para sa blood sugar. Kaya nga, kung napapansin nyo ngayon, marami nang lumalabas na cocoa sugar. It also improves digestion and many of the symptoms yung mga inflammatory conditions associated with digestive and bowel disorders by supporting the absorption of nutrients, including yung mga vitamins, minerals, and also providing beneficial dietary fiber. And also, it provides a quick energy boost na kung sakaling ikaw ay nauuhaw na o kaya nagugutom ka, magandang kainin yung coconut. Because of it is super nutritious, it adds extra energy in our body and it's utilized by the body to produce extra energy rather than to store it as body fat. It supports improved endurance during physical and athletic performance. It helps relieve the symptoms of tiredness, no? And coconut fluids, yung buko juice, no, has a lot of electrolytes. Kaya kung nauuhaw ka kaysa soft drinks ang iinumin mo, buko juice na lang, mas healthy pa. Good for electrolyte imbalance, no, para din sa mga, sabihin natin yung mga nag-LBM o nagtatae, magandang uminom ng buko juice. The coconut juice from the young coconut is very healthy and very good to cleanse the bladder, liver, and also for especially the kidneys. Ayan.
Alright, so napakaganda pala ng coconut. Dapat, alam mo, ang problema natin dito, marami daw mga coconut trees na matandang-matanda na at namamatay na, hindi na productive. Dapat ang mga coconut farmers should undergo a massive replanting of coconut trees. Kasi mga 100-120 years pwedeng mamunga yung coconut, no? Pero pagkatapos nun, bigla na bumabagsak ang production. So dapat ngayon pa, maaga pa, yun.
Maganda kasi ang coconut kasi may electrolytes din.
Oo.
Hindi
Well,
lang
that's
tubig.
really the source of energy, no?
Yeah.
Kapag ka kasi pagka lagay mo exercise ka o naglalaro ka, then nadi-dehydrate ka. Pag inom mo ng coconut juice, ang nangyari kasi pag nadi-dehydrate ka, nagkakaroon ka ng less electrolytes. So yung balance ng electrolytes mo bumabagsak. Pero pag uminom ka ng coconut juice, nare-restore yun, so you feel much more energetic and capable.
Ang dugo kasi natin dapat tama lang ang timpla ng tubig at saka yung electrolytes.
Oo.
Kapag sumobrang alat, yan ang dahilan bakit tayo nagkakaalta presyon, bakit nagkakaroon ng dysmenorrhea, bakit sumasakit ang ulo.
Oo.
Kasi pag masyado namang malabnaw ang ating dugo, yun naman nahihilo, nahihina. Kaya kailangan tama-tama lang ang timpla. Unfortunately,
Even to those with dysmenorrhea, siguro dapat nag-iinom sila ng fluids.
Tama,
no?
tama
Kasi
yun.
lumalabas yung dugong yun, nawawalan sila ng dugo eh.
Karamihan sa mga nagdi-dysmenorrhea, isang complaint nila masakit ang ulo.
Oh,
Kasi
that's because of lack of water.
dehydration. Oo,
Nadi-dehydrate sila, di ba?
I have isang magandang balita sa ating viewer. I'm very much involved with coconut, no? Yung integration of coconut. No? And so in other words, we were able to bring a certain yung to Switzerland, sa invention competition, no, yung tinatawag natin coconut growth hormone, plant growth hormone. They found out na itong coconut nito, meron tayong tinatawag na cytokine, no, which is actually a certain growth hormone. As a matter of fact, no, makikita natin sa mga beauty shop, meron siya sinasabi para sa buhok, kinetin comes from coconut.
Well, yung coconut oil, dati nang tugtugin sa probinsya yun kung paano ka magmamasahe ng anit mo tsaka para sa buhok mo eh. Yung iinitin yung coconut oil mula yung, hindi yung kakanggata, pero pagkatapos makudkod yun, lulutuin mo ngayon tapos pipigain mo to get the coconut oil habang mainit, ikinukuskus ng maigi sa iyong anit at saka para sa iyong buhok. Very healthy.
Kaya nangangamoy pinipig, no?
From Norma Velarde of Nueva Ecija, hindi ko alam kung anong kanyang cell number. Nakakasikmura po ba ang coconut juice kung inumin mo na di ka pa kumakain? Some people say na it might induce bowel movement, But it does not necessarily mean masisira yung tiyan mo.
Hindi naman.
Hindi
Dami
naman-
gumagawa sa probinsya ng ganyan eh.
Ang dami gumagawa, no?
Oo, dami
Hindi naman nasisira. Siguro nasanay na din sila na kain.
Walang malinis sa tubig, so kukuha
Oo.
lang sila ng buko, inumin
Aba,
na nila
nung
yun.
panahon ng hapon,
Tama.
nung walang makuhang pandextrose, ang ginagamit nila po, coconut juice. Pinifilter lang nila yan sa lagay mo sa t-shirt na gano'n. Yun ang dinidirect na parang swero.
May sine si Jackie Chan na ganyan eh.
Oo.
Nilagyan niya ng swero yun.
Di ba? So, kanya kailangan talagang makita natin na magaling. Marami pong gagawa. But good news, I just read in the papers today na ang coconut exports ng juice exports natin tumaas by over 80% in December. Very good. We should try to capture that market because right now I think Indonesia is even a bigger exporter and Thailand.
Thailand, yes.
Oo, pero kayang-kaya po natin lampasan yon.
Meron pa tayong mga coconut oil.
Oo, meron pa. 0928-981-731. Parang kulang yung cellphone number. But in any case, good AM. Query ko lang, ano po ang cause at symptom ng prostate problem? I think Brother Vic also talked about kung anong minsan nangyayari dyan is partly heavy metal toxicity like metals like cadmium, and that comes, let's say, from smoking, nangyayari yan, or maybe from too much ingestion of alcohol because of your drinking too much presence of alcohol in your body, in your reproductive organs might be a problem. But it's also, nagkakaroon ng symptom kasi sinasabi nila yan. Pag ikay daw ay tumatanda, talagang kumakapal yon as a part of the normal, what they call normal aging process. What they really mean is, habang tumatanda isang lalaki, nababagong hormonal balance. Mas na sila nagkakaroon ng hormonal imbalance. Many times, sa maraming lalaki dyan, bumabagsak ang kanilang testosterone level. But one of the culprits for the thickening of the prostate is when testosterone is converted by the body to dihydrotestosterone. Yun din ang sanhi po, kanya nahuhulog ang buhok eh. Yung DHT. Sinasara yung lamanan ba ng buhok. Hindi tuloy makakain at hindi ma-feed ang hair, namamatay. Numinipis at saka nahuhulog. So, the body naturally converts a certain amount of testosterone to DHT. And this is why for the prostate, dalawa ang madalas kailangan nilang gawin daw eh. You give them the alpha-5 reductase in order to prevent the conversion from testosterone to dihydrotestosterone. Pero, ang nadiscovery naman nila doon, pag hindi raw nako-convert ang testosterone to dihydrotestosterone, the body converts it to estrogen. So you have to give them amylase in order to prevent the body also from converting the testosterone to estrogen. Para yung laman ng prostata hindi na mamaga at lumalaki.
Lahat naman ng tao, mapababae, mapalalaki, meron tayong balance ng testosterone, yung ating testosterone sa estrogen. Balance yan, meron sa babae, meron, ako meron yan. Pero siyempre, nagpe-predominate yung isa. Ang isa example kayo, yung masculine features, kaya doon, mabuhok, mabalbasarado, ganyan.
Mas mataas ang estrogen.
Tapos kalbo,
testosterone.
mataas ang testosterone. Sa babae naman, ganda ng buhok na ganyan. Tapos female features, yung mga curvatures na ganyan, female hormones ang andyan. Ibig sabihin nito, natural sa ating katawan na magkaroon ng healthy hormones within us. But yung nga lang dapat aalagaan.
Ibang balanse ng lalaki, ibang balanse ng babae. Merong kaibahan, di ba?
General hormones, okay lang naman. Whatever it is. Pero yung nga lang, magpe-predominate yung hormones para sa lalaki kaysa sa babae. Okay. And one of the things na yung exercise na tuturo natin, hindi natin mamasahe yung prostate. Kasi nangyari, namamagana yan. Dapat namamasahe yan. Ang isang simple exercise which the viewers can see now, yung nakaupo lang tayo ganyan, patigasin mo yung
yung anus mo.
Oo, yung gano'n.
Ipitin mo lang. Alright, bring your knees together like that.
Some call it
press.
as Kegel. Sakala nila babae lang yon, pero sa lalaki meron din. Ngayon, nakikinig sila ngayon, nanonood ng TV. I-contract lang nila. Yung parang iihi ka, tapos pipigilin mo kalagitnaan, yun ang pakiramdam. At every time na ginagawa mo yan, I'm doing it now, hindi yung halata, pero ginagawa ko yon. Pero what happens daw, binamasahe ko yung prostate para hindi mamaga. And that goes also to the ovary, to the uterus.
Although, I know doctors that do what they call a prostatic massage.
Yes.
Kaya lang, sometimes a little bit uncomfortable pagkat papasok yung daliri sa loob, tapos
The
i-manipulate yung
purpose of prostatic massage is to collect semen para examinin nila. Yun ang main role ng prostatic
That's
massage.
the main role, but they also do it somehow just to
To have a release.
Oo.
Kasi
Para maano yung ano.
may
Yung
issue dyan,
prostate.
yung may pasyente ako. Unfortunately, the woman had breast cancer. 1 year after that, hindi ginagalaw ng lalaki kasi naawa siya doon sa asawa niya. 1 year after, yung lalaki ngayon nagkaroon ng prostate problems din.
Oh my.
So, ibig sabihin, pag hindi nagagamit, di tendency na
If
namamaga.
you don't use it, you lose,
lose it.
Okay. From 0906-221-2121 from Baby of Makati. Nakakatulong po ba yung regular na pag-inom ng coco juice for easy delivery of baby? Abay, I have to be honest na I'm kind of out of that league at the moment, but I have not heard of coconut juice for ease of delivery, but please educate me.
Just be hydrated.
Is that simply a question of hydration?
Yeah.
So it's not a question of coconut juice, even water, refined or yung malinis na tubig is fine.
How much water is one supposed to take? Ang advice is 3 liters. You don't count it by glass kasi iba-ibang size ng glass natin. You count it by liters. 3 liters for an adult. Bakit 3 liters? Kasi yan ang nire-reseta namin sa hospital. Bawa yung pasyente, walang kakainin, puro swero lang. Yung 1 litro dapat maubos ng 8 oras. Lahat ng doktor alam yan. Kaya ibig sabihin, in 24 hours, 3 litrong iniinom. If you go less than that, and that happens especially kapag busy tayo, kaya nagta-travel, kulang ang ating tubig, doon nakakaroon ng problema.
Okay. All right. So
Sasabihin natin yung easy delivery, no? In Chinese custom, pag ang pregnant woman, manganganak, they usually induce ginseng, adaptogen. Why is it na halimbawa effective yung ginseng? Because the ginseng brings about a certain better energy and better energy flow, no? Increase the yin, no? And also balance the yang. No? So pagka oras na nakikita nila na it also natutulungan yung mga mothers to deliver. Why? Because of help from the outside, increase the energy level.
okay, ito naman from 0935-940-8724. Good AM. AM from Nueva Ecija. Di po ba delikado ang mayoma kung hindi pa opera? Di ba ito nakakakos ng cancer? Well, many myomas are benign. Especially yung mga myoma o yung parang tumor pong nakakabit sa uterus o sa fallopian tube o sa womb, no? So, my own daughter had a myoma, but the common allopathic approach is buksan at alisin. Part of the reason for that is, I guess, the size of the myoma. Kasi pagka po lumalaki masyado yung myoma, ay medyo napepress ang mga different organs natin sa tiyan, no? So, it may also produce discomfort. Kung minsan sumasakit. O kung minsan it interferes also with sexual intercourse. No? Masakit. Kanya kung minsan ang mga babae nasasaktan, hindi nila alam meron palang myoma. So, if it's not malignant, is there something that can be done para matanggal yung mga myoma? I think most of that is also a hormonal problem, di ba?
Hormonal talaga. Oo.
So, maybe the approach there is to let the body deal with it unless the size is so large. Di ba? Na nakakasagabal na sa iyong pagkababae.
Some of the women will outlive it eh. Basta pagdating na nila ng phase na menopausal na sila at wala ng hormones na nagbibigay ng sustansya para lumaki yun, kusang liliit yan. Yung nga lang habulan yan. Sinong mauuna? Yung ba lumiit siya or yung obstruction na pwede mangyari sa loob?
Okay, but what you are saying is you can do something about the myoma through a rebalancing of your hormones. Is there something that you can take that can prevent that kind of myoma or tumor from growing by taking something which is anti-angiogenic, for example? Ano yun? Yung nakakatigil ng capillaries to form within the myoma to feed itself.
There's a study sa Obikaini, ang ginawa nila, they put a tube at binara yung daanan ng dugo, no? At yung kusang lumiit. Ibig sabihin nun is highly vascularized.
Okay, most of the tumors or the myomas are highly vascularized, otherwise it cannot continue. Now, there's of course another approach, and what they do is they attack the fungus that holds it together. For example, through the drip method, by putting hydrogen peroxide through you, that will attack both fungus and bacteria, etc., and virus, no?
May claim kasi sila dyan eh. Sabi nila is effective. Pero for me, more conservative ang approach ko eh. Nakakatakot kasi kapag you give a medication, meron side effect din yan. And then you have to counteract that with another side effect, which happens to other parts of the body. So I would suggest still the more natural, which is sabi ko nga yung isang mga exercise natin, mga ganun, kulang lang tayo sa oras ngayon, pero pwede ko pa sana i-demo yung mga
Oh,
exercise.
sige, go ahead.
Next
Pwede,
time.
may iba pang exercise. Sige, pwede
One
pa.
of the things is you just massage your prostate, you massage your uterus, your ovary. How is it? In a sitting position this way, so sinabi ko na kanina, yung
Yung
parang
pagpala ng muscle
pagpigil.
mo.
Okay.
Actually,
The other
the one of the muscle is good, lalo na kung buntis ka.
Yeah.
Why? Because when you exercise the vaginal muscles, it makes it easier for the baby to pass
come out.
through.
Tama yun.
Di ba?
Yeah, the other one is para mawala yung kalawang sa ating hips.
Oo.
So, you just simply, yung
Yung
nakikinig
ikot
sa atin
mo ganun,
ngayon,
yung balakang,
yeah,
or
one of
up,
it is
back and forth.
backward forward lang. Ganun
Ganun
lang
lang.
kasimple. Mamaya konti, you do it sideways.
Oo.
Mamaya konti, you do it twisting. Look as far as your eyes would reach. Mafe-feel niya, yung mga viewers natin ngayon, nafe-feel yung parang namamasahin na yung ating mattress, yung ating prostate. So,
Oo.
this thing. Ngayon, you can have other exercises. One of it is in your chair, you just rotate your hips. Clockwise and counterclockwise.
Ilang beses mo gagawin?
Nasa sayo, minsan 10 lang sa isang
Alam mo,
daan
minsan
nasa
pwede
sayo.
mong gawin buong araw yun eh. Di ba? From
Oh.
time to time. Hindi naman sasabing
Oo.
gagawin mo walang pigil, ha?
Kasi baka sa opisina naman sabihin, ano ginagawa mo dyan? Wala ka naman ginagawa mo. Gumagalaw ka. Sama
Yun
naman
naman
sa
yung
yan.
problema.
Okay. As an acupuncturist, we also do acupuncture for
At saka pag
problems.
wag mong gagawin yung pag-ikot na pag malakad ka sa kalsada sa
Oo,
sidewalk,
sabihin,
ha?
ay.
Baka pagtawanan ka ng tao.
Yeah, nakakatuwa yun, pero effective yun.
Oo.
For every step you move, tapos parang kang sumasayaw. Sabi yung nga lang parang
sa
belly
loob na lang
dancing.
that's why dancing probably is so good, no?
It is.
For the health.
Yes, yes. So we do acupuncture for such concerns, ano? Acupuncture with needles. Sa mga viewers ngayon, ang isang approach, tinuro na natin ito, one of it is sa likuran ng tuhod. Pwede nyo pisilin. Sa mga nakikinig ngayon, salatin nyo lang yung tuhod ninyo, taas ko tuhod ko, Okay. And then, abutin nyo lang dito, and then you just press it up dito.
Yung sa gitna ng
Sa gitna.
ng likod.
Sa alak-alakan.
Oh.
Meron sa likod yan, merong ugat doon sa gitna. Ito yung line ng alak-alakan, tapos merong ugat na nakaganyan. Kung saan nagpo-cross, pag pinrest mo yung masakit. Ngayon, pag nakabend na ganito, hindi mo masyado masasalat. Mas maganda kung nakadiretso ang paa. So, sa mga viewers, idiretso yung paa ninyo, salatin nyo.
Mararamdaman mo yung parang tendon doon.
Tama. That is, we call it in Chinese medicine urinary bladder 40 or Weixiong, or ibig sabihin, the natural reproductive health point para maging healthy yan.
Ayun. At saka nga pala, before I forget, naalala po ninyo na for the prostate, what is you must get your proper supply at least of zinc. At saka yung mga sterols, plant-based sterols, napakagaling for the prostate.
Basta plant-based.
Basta plant-based. Ha? So, marami pong mga
Coconut.
maganda rin. Alright, nga pala, makalimutan, and I don't want to forget, will you please tell us, magkakaroon kasi ng medical acupuncture certification course si Dr. Alagaya.
Yeah.
Why don't you tell the people about it if they want to attend?
Yes, ang course ko kasi once a week lang 'yon. So maganda yung pag within Metro Manila ka. Pero may pasyente ako, may mga doktor, exclusively for doctors lang. Pag gusto nilang other doctors, meron other non-doctors, may ibang kurso 'yan. But for me, it's only for doctors. Magsisimula itong Sunday. So itong
Saan ba yan?
sa klinik ko sa Makati. So it's around malapit dyan sa Cash and Carry. I-text na lang po nila ako. So it's
Okay.
going to be a 1-year course pero only once a week, every Sunday. Para sa ganun po, pag i-text nila ako, ibigay ko sa kanila lahat ng details.
Alright, that's 0917. Makita natin uli yung 0917-819-2959. That's the cell phone of Dr. Alfonso Lagaya. If you're a doctor and you're watching and you want to know more about acupuncture and how you can integrate it into your medical practice.
Marami na mga doktor ngayon, minsan mas matanda pa sa akin yung mga estudyante ko eh.
Oo.
They are now reinventing themselves. Surgeons doing acupuncture, OB doing acupuncture, anesthesiologists doing acupuncture.
Oo.
So, saka nagkakaroon ng merging itong usapang kalusugan natin, plus doctors viewing us, mas maganda ang bonding ng dalawa.
Okay. 0907-349-8164. Dok, paano po kung katatapos lang magregla, tapos maglalampaso ako ay biglang may lumabas ulit na dugo?
O, di mag-napkin.
Baka hindi pa tapos yung pagre-regla. No?
Hindi pa tapos.
Minsan merong hindi na
Kinabulan.
tinatawag na taghabol.
Oo, yun.
Ngayon, kung ikaw nag-exercise, magaling kang maglampaso o kaya magbunot ng tabla,
Maganda yung yung
Magandang
naglalampaso.
exercise.
Kasi it's an exercise that moves the hips.
oh,
Kaya ang advice ko sa mga hindi naglalampaso, kahit na paano, pumunta ka sa iyong banyo, yung square, yung rectangular ng banyo nyo, bago kayo matapos maligo, bumuna ka ng any towel, o yung mga budot,
tuyuin mo
Oo, tapos
ng iyong paa.
kuskusin lang, sideways, and then to and fro, maganda yun sa hips.
Okay, meron din palang, meron daw round table ang PICAM.
Ay, oo.
On infertilities of males and females.
Yeah.
Yung hindi daw kakayahang makabuntis ng lalaki at babae. Kailan ba yun? February 21, 2013, Thursday. Oras po, 5:30 to 9 o'clock, dyan po, ng gabi. Dyan po sa RAL Room, Club Filipino, Green Hills, San Juan.
It's a roundtable discussion. One of them would be me. I'm one of the speakers.
Ikaw nga pala isa doon.
Oo.
Isa doon si...
Dr. Chat Austria.
Chat
maging guest
Austria.
ko rin yan. Saka si Dr. Jimmy Dillaco.
Ayun, yung tatlong magagaling ang nandun. Kanya kung gustong makadinig po about male and female infertility, pumunta kayo doon. Alright? Alright, don't forget that ito namang ating co-host dito, si Dr. Lady Ruby Tagulao, ang kanyang mobile number 0917-977-5468. Ang email address niya, ladyruby, that's LADYRUBI @gmail.com. If you want to consult, you want to see her. And she has her own wellness clinic in Subic.
Yes.
But she can also see you in Quezon City, in Dr. Sam Dison's clinic there.
Very
And
good.
then,
Okay.
meron ka din ata pang pisina sa Tarlac.
Soon po yun.
Malapit na.
Malapit na.
Alright. So, yan, at least we're getting now a nice network of people that can be consulted in different parts of the country. Para meron naman silang alternatibo.
Dr. Sam Dison is one of the good
Oo.
doctors also. Ito yun.
Yeah, he's also guested with us here.
Galing.
Alright, well, it looks like we're running out of time once again. So don't forget Dr. Alfonso Lagaya, who is a medical acupuncturist, as well as being a doctor. Binigay ko ng cellphone nyo sa kanya. Ang kanyang email po, lagaya_md_ac@yahoo.com. Okay? And then, of course, I gave you the numbers and the address of Lady Ruby Tagulao, Dr. Lady, if you want to consult her and find out what to do with yourself. Alam mo, pinag-usapan po natin ngayon yung male and female reproductive systems, no? Unfortunately, we were not really able to cover too much. We covered a fair amount of detail as far as female reproductive organs are concerned, not so much the male. Ang hindi pa natin natatalakay dito are the common disorders, At na-focus tayo sa karanasan ng pagre-regla, yung masakit, yung ganito, yung haba, etc., etc. And maybe next time we will be able to go back and review this issue.
Maganda nga setup nyo ngayon kasi dapat there should be male and female, that's yin and yang. Now we have the host who is the male, no, and now we have a female which is the yin, kaya yin and yang.
Balansyado, mas balansyado.
Lahat ng opisina, lahat ng bahay dapat balanse yan.
All right, we've run out of time. Thank you for being with us today. We'll see you next week. God bless you.